Hey, Eva,
Yes.
am I allowed to fine everybody that's not wearing a Rotary pin?
That might be a good idea.
Okay, Eva,
Yep, ready?
take
Okay,
it away. Ring the
thank
bell.
you. Ring a bell. I should have a bell, shouldn't I? Okay, so first of all, I have this all organized here. Thank you all for coming on here. It's so good to see you. And thank you, Bill, for co-hosting. Bill and I are co-hosting this. We will mute you and we will unmute you. We'd like you to mute yourselves if you're not talking. And also, this is being recorded for YouTube, and you'll be able to go and see it after tomorrow, probably tomorrow, or even this afternoon, probably. And we have also today, possibly, the president of the Port Orford Club, Uli Law, joining us. And I don't see him yet. So we shall start. We were going to start with Carrie, who says she's joining, telling us about the hand sanitizer project, but because she's not on, could you do that, Steve Scheiderman?
Sure.
There, go ahead.
I see Carrie's name on there, but I don't see video. Carrie, are you there?
I know. It just keeps saying joining for Bill and I. We see that she's trying to join, but she's not getting in. So go ahead and talk about it.
I'll report. Carrie has been our team leader on the Rotary Clean Hands project and doing an excellent job with this. And the team consists of Carrie, President Eva, Tom Bennett, Amy Bailey, myself, and now Alan Ledesma. And yesterday we picked up 80 gallons, 81-gallon jugs of hand sanitizer from Stillwagon Distillery, and we were escorted by Charleston Fire Department to North Bend Medical Center's parking lot. And there's Carrie.
Yes,
Carrie?
she's here.
Carrie, you want to take over this?
She needs to unmute.
She needs to unmute.
I muted. Go ahead. It looks like you started. My Zoom kept telling me I would be connected soon, but nothing happened, so I tried again. I apologize.
Okay.
Go ahead.
We kept trying to get you in.
So we arrived at North Bend Medical Center where Carrie and Amy and Tom were all set up, ready to go, and we were greeted by several fire departments, several police departments, and quite a few medical service representatives. And we passed out 50 of the 80 gallons so far to include 4 police departments, 9 fire departments, and 2 major medical clinics, being North Bend Medical and Bay Clinic, and then representatives from 14 other providers of some sort of medical need, such as hospice, Coos Health and Wellness, South Coast Physical Therapy, and many more. And so we're off to a great start. The team is going to be having another Zoom meeting after this Rotary meeting and plan our next steps. And I'll be glad to entertain questions, or Carrie might entertain questions.
It was a good day.
I have a question.
I muted myself, so whoops.
Al Solomon had a question.
Yeah. Now that delicious rum is edible. What's coming out of the distillery that makes this hand stuff not edible?
First of all, it's 80% alcohol by volume.
As a student, I used to drink 95 and do well.
And then it got some other ingredients in there, and it is labeled not for consumption. This is external use only.
Propylene glycol. Yes. There's also propylene glycol in it. Can you hear me?
I can do it. Yeah.
Okay.
Steve?
Yes.
if I might jump in just real quick on behalf of Stephanie, who's not here, and just remind folks that you guys did a great job putting the story up on the Coos Bay North Bend Rotary Club page. And it is incumbent upon all Rotarians then to go out and share that news on your own pages. So if you have Facebook, please, I encourage you to do so. And people, so that non-Rotarians and the like get a chance to see what we've been doing. And also we sent out press releases all over the place. So I'm not sure how many were able to take part, but we did get at least the local news. I saw on KVAL and KPIC, it was on their website. So just a reminder again that when we do things like this, it's part of our constant, not just patting, it seems like it's patting ourselves on the back, but it's more of a membership drive for future Rotarians to let them know the kinds of things and the kinds of works that we do. So when you see things like that, to share them.
Good job. Eva?
Hey, I got to step in here for a second. Hold on, everybody. My internet connection is unstable, it's telling me. So if I leave, if I disappear, Bill, you're going to take over, okay? Did you hear me?
Yep.
You're muted. Okay, all right. Okay, any more questions? We need to go to our speaker. Where did
Can
she
I
go?
say
Right
one thing?
there. Sure, go ahead.
Okay, we still have the 8-ounce bottles. I think we have many of them left over at Marshfield Mercantile for members. If they haven't picked up theirs, then get a hold of Steve Schneiderman and stop by and pick them up at the hours that he's available. That's it.
Great. So it's a great job. Thank you all. What a team. Okay, I believe this is Ashley. I'm trying to unmute Ashley. There, unmute. Ashley?
Hello, can you hear me?
Yes. Yes, I can now. Everybody, this is Ashley Brainard. I have not met her before either. And she is the supervisor for the Department of Human Services, Child Welfare, Child Protective Services in North Bend. So
Yes.
if you'd like to tell us a little bit about yourself, could everybody
Sure.
mute themselves? Everybody else but you are going to be muted now, okay? So we don't have any
Okay.
background noise.
Great. Okay, so my name is Ashley, and I am a supervisor here at DHS for the Child Protective Services Unit. I am born and raised from North Bend. I grew up here, and then I left the community for about 6 years. I went to college at Oregon State University, and kind of landed back here with a job opportunity when I graduated from college. I worked for Kairos Northwest Services for 5 years. They are directly aligned with Coos Health and Wellness, and so I worked with children with mental health diagnoses for about 5 years. And then I came over to the Department of Human Services. I had a couple of coworkers that came over to the department, and they convinced me to come over. So I've been with the Department of Human Services for about 4 years now. I was a child protective service worker, and then I moved into a supervisory role, and I've been a supervisor for about 2.5 years now. So I really believe what we're doing is important, and so I wanted to share with you guys today a little bit about the department and some statistics. And if you guys have questions for me about our role in the community or just specifically what we do, feel free to ask at the end if you'd like. So I'm not sure if you guys are aware, but April is Child Abuse Prevention Month. And this year is obviously a lot different than years in the past, as there is the COVID pandemic right now. Typically during the month of April, I, along with some workers, would attend the Child Abuse and Family Violence Summit in Portland, Oregon. It's a very large week-long conference with speakers throughout the world that come regarding different cases. It's very, very interesting, very informative. So that's normally something we would do this month. We're not able to do it, but hopefully in August, we'll be able to go to Dallas, Texas to the nationwide Crimes Against Children conference. So I'm looking forward to that if I get to go. I don't know if I'm going to get to go though. I'm not sure if you all are aware, but in the past year, we have gone to a centralized screening rather than countywide screening. And so that means that all of child abuse and neglect calls that get called into Oregon are called into the Oregon Child Abuse Hotline, and that is centralized in Portland, Oregon. It's taken some time to get the kinks worked out in this system, but we're really starting to see some positive feedback from going into a centralized system. And the reason that we did that is so that all of the calls are taken essentially with no bias, which is super important. And centralized systems are very common now throughout the United States. It's not often that we see calls that are being taken in at the local level at this point in time. So that's another reason that we moved towards a centralized screening. And also, we are operating 24 hours a day, 7 days a week, 365 days out of the year now. So when a call comes in, if we need to respond immediately, we do. And it doesn't matter if it's a holiday or a weekend. We have staff that are on call, and we are ready to respond. So that is something that is new in the past year. So that's pretty exciting, I think. And I wanted to give you guys some statistics on calls that have been coming in. So these are from 2018 in our state. We generated 84,233 screening reports of child abuse and neglect in the state of Oregon. That is significant. That is a very high number of calls, and I don't know if people realize how many calls we actually have coming in. And that is actually a 4.5% increase from 2017. So again, that's pretty significant. And in 2018, there were nearly 8,200 children who were victims of child abuse and neglect that the allegations were substantiated. And nearly 4,000 children were placed into foster care. So since the COVID pandemic, there's obviously been a lot of drop in calls. We really rely on our mental health workers, our teachers, our doctors, anybody that's a mandatory reporter to be making calls to us. And those calls have dropped significantly. Since the pandemic, we've seen a nearly 70% decrease in calls, which is highly concerning. You know, we have children that we know that school was their only safe place to go. School was their only place that they were getting 2 meals a day. And so we have a lot of concern for the children in our state at this point in time, because there are a lot of calls that are going unrecognized, and we are preparing for when school starts again, hopefully in the fall. We are prepared to see a dramatic increase in calls to the point where we're going to have to be looking at probably doing shift work because we are really anticipating an increase in calls that we're going to be getting. So that is something to be considering. We currently are supplying lunches and meals to our children that are in our foster care right now. The workers that generally supervise visitation are traveling throughout the community and working with members in the community to ensure that our foster children have lunches and activities and things that they can be doing while they're at home. And so I know a lot of our local restaurants have been helping out, which is fantastic. Currently for the department that I supervise, we still are having to go out in the field, and we are still having to go to people's homes and interact with them and go in people's homes. And that has been difficult considering the circumstances. Our workers all have the proper equipment to be going into the homes. We have face masks that have been donated to us. We have gloves, and they are all taking precautions. And a lot of us are actually teleworking right now. So we're taking shifts coming in and out of our office. So we are not fully staffed here in the office right now. And we actually are not doing face-to-face visitation right now with our families and children that are in care, which has been really difficult, especially for the, the parents whose children are in care. We know how important those visits are. That is something that has been, brought down from the top, that we're not able to be doing that right now, but we're hoping to create a strategic plan here in the next couple of days to start looking at opening our building back up to have some kind of visitation face-to-face for our children and their parents. For our unit specifically, we get between 100 to 120 assignments of abuse and neglect a month, and we have only gotten 45 this month. So that is very significant. And so we are working on right now getting caught up on things that we've been behind on. And again, kind of just preparing for what we believe is going to be an influx in the fall. Does anybody have any questions for me? Or are they wanting any more information on numbers or statistics as to what we're doing, or any questions specifically on the work that we do?
Are you testing anybody for the coronavirus, or what are your protocols going now?
Here in our office? So we have a very similar protocol to, I would say, like what the health authority is asking. If you're feeling sick, please do not come into the office. If a staff member is tested, we would, again, ask them that they need to quarantine for 14 days if they're showing any symptoms. We have not had any issues with any of that at this point in time, which is great.
Do you have anyone connected with the Shutter Creek facility?
I'm sorry, could you say that one more time?
Do you have anybody that knows anybody from the Shutter Creek?
We do, yes. Yes, and those people are not coming into our office right now. So that's been fantastic on their end.
Good.
Yeah.
How do you work with the Kids Hope Center?
Oh my God.
Heidi.
So we work very closely with the Kids Hope Center. Any child that's examined for a medical exam that we're involved with, we work directly with the Kids Hope Center with those children. If we have children that are needing to be forensically interviewed for an abusive or allegation of abuse or neglect, the Kids Hope Center will conduct those forensic interviews, and we will sit in and observe those interviews with a law enforcement officer should the allegation become a criminal allegation towards a child. I am the representative on the multidisciplinary team for DHS, so I attend those meetings bi-monthly, and we staff any shared cases that we have during those meetings as well. So we work very, very closely with them.
This is Stephanie. I have a question. With regard to the assignments this month, you said you have normally anywhere from 100 to 120 assignments.
Carl.
And you're at 45.
Taking a nap.
What is your reason that you feel we've had this drop, and what is your concern?
Well, the main reason I believe is because children are not in school right now, and they are seeing their mental health counselor should they be in counseling, but the dynamic is different because it is over the phone or over Skype, and so if a child feels like they're wanting to disclose, I think it makes it a little more difficult for them, especially knowing you know, if the perpetrator is in the same home during that time, it makes it difficult. But really, the school staff made up a really large percentage of our mandatory reports that we were getting. And so I think that has been a really big reason why we've seen this significant drop in assignments.
So is that why you're expecting an uptick as soon as school is back in session, or there's more
Yes.
organized?
Absolutely. I think that once we are able to start having those face-to-face contacts, that our community partners who are mandatory reporters, when they're able to do that, I think we are going to see a lot of referrals, because I think we're going to see a lot of children disclosing things that were occurring or still are occurring in their home. A lot of the assignments that we've been getting at this point in time are coming directly from law enforcement. So they're going out and responding, and then they're reporting it because of the significance of it. So that's a majority of the reports that we're getting at this point in time.
Mike Gaudette has a question. Mike?
Can you tell me how many children are currently in foster care in Coos County, and how many foster parents are there in the county to take care of those children?
So I'm going to give you the best number I can. I did not pull that exact number, but there are about 400 children in our county in foster care. We are one of the highest counties in the state for children in care. And we are also one of the highest counties in the state for domestic violence and sexual abuse in our state. We see that a lot. Foster parents, we are always in need of more foster parents. We do not have enough foster parents for all these children. I do not have that exact number of foster parents that we have for us in our county, but I don't think we have, I would say no more than 20. So we are always looking and recruiting and trying to find creative ways to have people look into being a foster parent. It is certainly a need in our county, and it's been a need for a long time.
Did I hear
Anybody
you
else have a
say?
question? Put up your hand. Put your hand up and I'll unmute you. Who wants to talk?
This
Mike,
is
you want
Mike
to talk
again.
some more? Okay, go ahead.
Did I hear you say that there are only 20 foster parents in the county
I'd say 20 to 25, yeah.
for 400 children?
Mm-hmm.
Okay. Are
Yeah,
these?
we have a lot of foster parents who they could have 4 to 6 children in their home at a time. And that is problematic. Absolutely.
Put your hand up. Tell me you want to talk. Do I have anybody else who wants to ask her a question? Oh, I'm muted. Can you hear me?
Yes.
You're
Yes.
good. Okay. Any other questions for Ashley? Okay, here
Tim does.
we go. Tim?
Ashley, do you work with CASA volunteers, and how has the court situation been impacted with this COVID?
Yes, so we do work with CASA volunteers. Typically, they are appointed to the child when we become court involved at either the first or second hearing. We're really working on getting them involved in the case very early on. So as for the court piece, that has been, it's been going okay, but it has been a little tricky in that a large portion of the hearings are now telephonic. So we still are able to appear in person, but they're encouraging the telephonic type of hearings. And I've actually been doing some mock court hearings with the judge and attorneys, so we can actually do hearings kind of like this in a Skype setting until we're able to do those face-to-face hearings. But you know, as for court, I mean, it really hasn't been impacted too bad. I mean, we've been able to get through it and get our families, you know, the due process they deserve, and it's been working okay. So, yeah.
Will you be needing, do you anticipate needing more CASA volunteers? I mean, I guess you always need more CASA volunteers. but
Absolutely, yes,
more of those?
absolutely.
So Ashley, if there's only 20 families in Coos County, do you send the kids out to other counties where there are more foster families that will take them?
We sometimes do, and I should be a little more specific. So when I say 20 to 25 families, that would be general foster care applicants. We do have children that are in child-specific homes, which means maybe they have a family member that's able to become certified, such as, you know, an aunt or an uncle or a grandmother or grandfather. And so we do have children that are in those specific home settings where they would not take any other children. They would just take their family member, and they're able to become certified. So 20 to 25 general foster homes, which means they would be able to take a child that comes into care that maybe does not have a family member that's able to be certified. So we do have quite a few child-specific homes as well. So that's good news that there are family members out there that are able to become certified for these children.
So relative to other counties in Oregon, do we have the same amount of per population number of homes that will take children, foster children? Or are we low taking them? Or
we do actually have better numbers in some counties, which may sound surprising. I know Douglas County has a major shortage in foster homes right now, and they will reach out to our county a lot of times to see if we have any homes that are available, because they just do not have homes to place children in. That's the main county that really reaches out to us because they're our sister county. I think, you know, if you go up north towards Lane County, Multnomah, up towards Portland and Salem, they'll typically have more general homes that are open. It's rare that they reach out to our county for homes. So it's the more rural counties that have the struggle with getting those general applicants.
okay. Anybody else with a question?
Yes.
Raise your hand. Oh, there. Okay, gotcha.
How many staff members did you say that go out in the field and make home visits?
So right now, just the Child Protective Service unit is going out and doing those face-to-face visits, which is our unit. We currently have 12 workers. We each have days that we are on what's called immediate response. And so on those days, if we receive a referral that we need to respond to, we will go out and respond. So we do have a lot of other caseworkers in our building, but they are able to fulfill their job duties through Skype at this point in time. But because of the nature of what we do in assessing those abuse and neglect allegations, we have to go out and be able to physically see the children and make sure that there's, you know, no injuries and that there's food in the home, or if there's drug paraphernalia or anything like that, we have to be able to see that.
Can the Coos Bay North Bend Rotary Club Clean Hands team offer your agency a gallon of our hand sanitizer for your staff that goes out on home visits?
That would be fantastic. We would love that.
Very
That'd
good.
be so appreciated by our team.
All right. We will we have a gallon with your name on it down here at Marshfield Mercantile for if you want to send a representative down to.
That would be great. Thank you so much.
Deanne, I'm trying to unmute you, but I can't unmute yourself. I keep trying. What go? Oh, there it goes. Okay, now
I'm
you're
on.
on. Okay.
Do the police go out with these home visitors very often?
Yes, we work really closely with law enforcement. I would say more than less, we do go out with law enforcement assistance, which is fantastic. So yes, we go out
So
with them.
you are first responders.
Mm-hmm. Yes.
Okay. Ashley, are you concerned that you're missing some cases?
Absolutely. Absolutely. Yeah. I mean, we would normally get between 3 and 6 new referrals a day, and we've been getting maybe 1 if we're lucky. So I'm absolutely concerned. And given the statistics in our county, you know, we know that there's a lot of poverty in this county. We know there's a lot of substance abuse in this county. There's a lot of domestic violence in our county. I can assure that it's still occurring despite COVID. And so I just think that our lack of mandatory reporters and their ability to see these children and talk to them and ensure their safety is really impacting, you know, our ability to go out and ensure child safety as well. So it's very concerning.
So is there anything we can do as just as citizens to, I don't know, if we hear something or next door neighbors screaming or something? I mean,
Yeah, I mean, so, you know, I think the biggest taboo thing that I hear is people will see things or hear things, but they don't want to call. And anytime somebody calls in a report of child abuse or neglect, it is confidential by statute. We are not able to give away who reported anything. That information is always protected. And so I always encourage people to please call. Please call if you see anything or hear anything. If you see a child who is, you know, acting in a way that does not seem typical to you, that they're, you know, if you see a child that's hoarding food or has injuries on their body and that just doesn't seem right to you, and you have information about this family, you know, please contact the Oregon Child Abuse Hotline, and I can provide you with the number at the end.
okay.
But I just want to encourage people not to be afraid to call. You know, that is the big thing. People are just afraid to call because they don't want their name associated with the report, and I totally understand that. But that is the biggest piece, is just reminding people that that information is protected, and you know, one phone call could save a child's life, and that is the reality of it. It is the scary reality, but it's true.
Mike, you have a question?
What percentage of children that go into the system do you eventually have to terminate parental rights?
Mm-hmm.
And if that happens, what percentage are you able to permanently have them be adopted out?
So I don't have numbers, but I can work on getting those for you if you'd like them. I would say probably a quarter of our cases, we would go to a termination of parental rights court hearing. And we would have those children be adopted to their forever family. We really, you know, we want to look at reunification and offering services to the family to try to ameliorate the issues first. But sometimes, you know, that just, it just does not happen, and that's just the way it is. And we have to do all efforts to work with our families, and if they are just not in a place where they're able to, you know, do the services or kind of get back to a safe place of parenting for their child, then we would look at going that route. But so I'd probably say about a quarter of our cases. That seems like a right number to me.
And the follow-up to that is, when you have to do a parental rights termination,
Mhm.
is it typically because of drugs in the family, or is it sexual abuse, or is it just neglect in general? What do you see, in your experience?
In my experience, the highest number of cases that we really get are lots of substance abuse. We have a lot of that in our county. So neglect is the highest and number one issue, and that would be statewide as well. Chronic neglect is what we see a lot. There are those cases that are extreme, those sexual abuse cases, physical abuse cases, but our highest number of cases that we see are neglect cases.
Any other questions?
I have another question, and that has to do with, in general, are you seeing evidence of trafficking in Coos County?
Mm-hmm.
And are some of these cases of fostering because of children that have been trafficked?
So that's a really great question. There's absolutely trafficking occurring in our county. We live on Highway 101, and that is a main pipeline to California and Washington. It's absolutely occurring. Specifically, have we gotten cases on trafficking? We have not gotten any specific cases on trafficking, I would say. We do have children that have been in foster care that have ran from their foster home, and as a result of running, they have been trafficked. Typically we find them again, thank goodness. But that is where we see the trafficking piece. These children that are very vulnerable and at risk, and then they are put into these situations that are very risky and dangerous, and unfortunately they have been trafficked as a result. So yes, there's currently a trafficking team that's been formulated by the Kids Hope Center. I'm on that team, and we are working diligently on a community plan for these specific issues.
Okay. Anyone else? We just had Yuli Law come on from Port Orford. Yuli, do you have any questions?
Not at the moment. Thank you, Eva, President Eva, fellow Rotarians. Sorry, I had to engage the camera. I was a little late, so.
So no more questions for Ashley? No? Ashley, thank you very much for doing this. You will give us that number for the
Yes, I'm
hotline.
going to give you guys the number. And this is for the Oregon Child Abuse Hotline. You can call this number 24 hours a day, 7 days a week, 365 days out of the year. So that number is 1-855-503-SAFE, S-A-F-E.
Okay. That'll be on the YouTube video too then. Okay, Great. Heidi, thank you, Heidi. Okay, so you're welcome to stay on and listen to Joe Benetti, Ashley. He's going to tell us what's going on with masks and everything else in Coos County. And I'm going to unmute you.
Great, thank you.
There. Thank you very much.
Thank you.
Yes.
So the Coos County, Coos Bay City Council has been encouraging everyone to wear masks. As you know, we've had a couple of medical people on this program, Brian Moore and Dr. Sharman, that have advocated wearing masks in the community. Now the county has lifted the ban on lodging, so we will have guests coming in. Coos Bay City Council had our city manager write a letter to Coos County asking if they lifted the ban, which they did, would they mandate that the hotels hand out masks to the guests? And county went ahead and did that, and we were glad to see that. And now with the spread of the virus, we're a little bit more concerned, and so we're trying to get masks out. We had our chief of police, the Fire Chief Anderson, go out and do a survey of all the stores, and the stores in the area indicated, are the employees wearing masks? Some said they were mandating it. Some said they were not. It was kind of a hodgepodge of things happening. It's kind of discouraging that not everyone was advocating their employees to wear masks. And then we also asked them how many people are wearing masks that come into the stores and how many people are visiting their stores on a daily basis. So the consensus came back and the questionnaire was answered by these stores that like 10,000 people are visiting these stores a day. That's in Coos Bay. That doesn't count North Bend or anywhere else. And the highest percentage of any store responding that said people were wearing masks was 40%. So if you take that into consideration, there's 6,000 people going to the stores a day that are not wearing masks. And so, you know, if we want to keep this, in my opinion, if we want to keep the virus down and we want to open our area and help our businesses, opening as soon as possible is critical and important. And the only way to open up, according to the state and the federal guidelines, is by keeping the virus down. If our virus increases like it is now, we are not going to be able to open up, which is a shame to our businesses because we're hurting them. So it's been my point, and and most of the counselors, well, I should say all the city councilors want to try to get our city open as soon as possible. And we feel that asking people and encouraging to wear masks is the most important thing to do. Getting masks to people is the issue of the day, in my opinion. I don't know how we're going to accomplish getting 6,000 masks to people. Workforce SWOBA has purchased 100,000 masks, and the city of Coos Bay has purchased 10,000 masks. The county has put in 5,000 to purchasing masks to help in the county. So there we are. We have a lot of people making cloth masks, and hopefully they can help participate in getting masks to everyone. So I just advocate that we try to all get masks to people and encourage people to wear masks out in public.
Questions? Put your hand up. Question. Steve. Okay, Steve.
So the number of people that are wearing masks is great, but the part of the equation that was left out there is in surveys, how many of them are wearing them improperly? And unfortunately, I see every day probably about 30% of the people that are wearing masks are not wearing them properly, and therefore they are ineffective. So we need to have an educational aspect to go along with that.
And that's been presented by Lindy Quinn with Zonta, and also your current president, Eva, have discussed trying to get information out. They've suggested that there be personnel at the stores and hand some of these masks out with criteria and a board stating how they should be done. Getting that information from Coos County Health and Wellness.
So I would just like to support Joe in this endeavor. Can you hear me?
Yes.
Yeah.
Yes.
To wear masks. As of yesterday, there are 15 cases of COVID-19 in our community, and there's been some recent community spread. So it's not just in Shutter Creek anymore. It's within our community and person-to-person transmission.
Okay.
And Joe, is there any way, if you could, I think along those lines of wearing the masks and wearing them correctly, if there can be some sort of a signage that can be produced by the state or by whoever the powers that be are that would have the budget to do so, to put those at the prominent places in the store as you're walking in, that like you have at the beach for, keep your, always never turn your back on the ocean, that sort of thing. If you could have that sort of thing produced so that when you're walking into the store, you see, now again, there's a bunch of knuckleheads that aren't going to pay attention, but if you put it up there so that people see, mask on and this is how you wear it, that sort of thing, that's easy to see.
Oh, and I agree. I think that's all part of it. I mean, it's not just, give everyone masks and that's going to work. I think it's educational, as Steve mentioned, as you mentioned, it's, informing people that it needs to be done. Another thing the workforce does also, I need to let everyone know, and you can tell any businesses, any employee or employer that needs masks for their employees, we will give it to them. We will absolutely give them the mask. So they'll, no cost, no charge. They just need to let us know. We'll bring them over to them. And, that's, for instance, Smart and Final and Cash and Carry. I was down there the other day. I was very pleased, and I told them. They had a sign up said, mandated masks need to be worn in here. No more than 2 people in a party together. Keep safe distance. So I walked in, I said, are you mandating this? And they said, well, we're trying, but our biggest problem is that people walk in without masks. I said, so if I got your mask, would this help? And they said, absolutely. Next day I took down a couple cases of masks and I gave their employees masks. And so they will hand them out. Now, will everyone wear them? Who knows? But at least it's, you know, it's a step in the right direction to trying to help control things. And like I said to begin with, I want to open our town back up. And it's not going to get opened up unless we're able to curve, as Steve Shimtakar said, unless we can curve this increase, you know. And now we have the lodging coming in and people coming in visit. So it makes me concerned, and I don't want to impact our businesses any more than possible.
So Bill, you have a question? Bill?
Yes, thank you, President Eva. First, I want to thank you and the board for purchasing a premium Zoom account so that we could have a discussion like this that goes longer than 40 minutes. I think this has been really probably our best meeting to date. I wonder if anybody has connected with Chris von Lobodon. I've been thinking about Chris because I've seen a couple of posts on Facebook kind of berating the employees up there at Shutter Creek. These are frontline people that deserve our support and respect, and our community is better than that if there's any kind of a sense growing at all. But we've got 2 members of our club from Shutter Creek, and I just wonder how they're doing or if anybody has checked in on them. That's one question. Any feedback on that?
That's a good idea. I can certainly get in touch with Chris. Yeah, I know Chris well, so yeah.
Has anybody in the club connected with Chris?
Nobody? Nope.
Well, maybe I'll follow up then as well. And a second question, Emily Francona down in Port Orford is eager to get some cataract surgery done at the hospital. Is there a date that's been announced when elective surgeries are going to be possible again here in town?
Yeah, I can address that. Bay Area Hospital is opening up in a guarded, safe fashion to elective surgeries up to 50% capacity on May the 4th.
Okay.
And so is North Bend Medical Center, I believe. We're having a board meeting later today to discuss that.
All right. Thank you, Dr. Stephen. Yeah, that's it. That's all I had, Eva.
Mike, here you go. Go ahead.
Joe, as the owner of a vacation rental in Coos Bay, where can I still get masks for guests who are going to show up without one?
Well, that's why SWOBA, the workforce, has they have an online system, online ordering system. I'll make sure I forward to Bill or Eva, and they can send it out to the club. So you can go on there, order 1 mask, 2 masks, 3 masks. And that was one of the reasons they got these masks, because that lodging was lifted and with the mandate that they handed out to their guests. So
that would be great.
There's masks available and PPE, other stuff. There's sanitizer that you know they participated with this club on, and they have KN95 masks, and they have the disposable masks, and you know they have different things. So
excellent.
Deanne, we did unmute you.
Okay.
Just say again. Okay.
Am I on?
You're on now.
Okay. 2 rubber bands and a piece of fabric. You can fold them and make a mask for your guests. And then afterwards, you can launder those pieces of cloth, and you could even use a coffee filter in the middle of it. They're real easy to make. I think they've been on YouTube. I've made a few of them at home just for fun. And if your guests would use those, you could rewash the fabric. Throw away the rubber bands, they're cheap, and you'd have them.
The size is 20 by 20 inches. That's the best way to make it, 20 by 20, and fold it is really, you can do it in a minute. I've made them a number of times. But let me tell you something else. Jay Schaefer, our Rotarian Jay Schaefer, sent me a link to Russell Hampton Products for Rotary, where they've made masks, 250 the least you can buy, but they all have Rotary symbols on them, and they're CDC approved, and they're washable,
one.
and they look pretty good. These, hold on, Deanne, they look pretty good, and we can order them. They're $3.75 per mask, but you have to order 250. I don't know if you'd be interested, Yuli, down there in Port Orford, and going together on that, but we could do something perhaps that way. They're pretty cool. I'll put them up to show you what they look like. So
I put the link to the supplies on the SO web page up in the chat. Sorry, I sent it to
Okay.
Heidi privately, but I figured it out.
Thanks.
okay. Thank you, Deanne. Anybody else with a question for Joe or for anybody?
I have a question, not about masks, but just to clarify for me, because I got confused. Maybe Stephen can help me, or one of the other medical folks. The tests that they're doing at Coquille Valley Hospital versus some of the tests for coronavirus elsewhere, say the one that they're doing now at Walgreens up in Portland. What are the differences on what the tests they're doing at Coquille Valley Hospital versus some of the other testing that they want to be doing?
Okay, well, the test that they're doing at Coquille Valley Hospital is an antibody test. And what that will show you is whether you've had the virus, whether you've developed antibodies toward the virus by actually contacting the disease. And so it's not something that will indicate whether you have COVID-19 active disease at this point in time. It's something that tests whether you've had it sometime in the past. So the test is really only available if you're not symptomatic. If you actually have symptoms, it's not that reliable. So the other tests with regard to sticking a swab up your nose or into your throat, or checking any other kind of respiratory secretion, is a test that determines whether you have the DNA of the COVID virus itself in your system. So that's a test that will determine whether you have an active infection at this point in time.
And those we still aren't doing locally unless you're at a certain elevated degree.
That's right. So the test with regard to determining whether you have the DNA in your respiratory system, we don't have enough capacity to test asymptomatic people or even people with minimal symptoms. So that test is really only being performed for people with significant symptoms at this point in time. In other words, and I believe this is still a national problem, there is not enough capacity to test everybody for active disease at this point in time.
Okay.
So Steve?
Stephen?
I have to jump off in just a second, so I wanted to just get this in before. Comment on the Facebook post about the hand sanitizer from someone that says, "Thanks for delivering to essential workers. There are no germs that will survive this potent hand sanitizer. It actually makes me laugh a little mid-shift when I re-sanitize. Thanks for keeping me germ-free and amused in a stressful workplace by simply sanitizing. I may smell like an alcoholic, but I'm germ-free."
Thank you, Steve. As for the antibody test, I did it, and I got my results yesterday, and I'm negative for antibodies, which means I did not have COVID-19. I was sick with a couple of colds in January and was on antibiotics for a couple of times, and we kind of wondered, but I don't have the antibodies, so I never had it. So I got my results yesterday, and Bill, you haven't got yours yet?
Yes, I did. Linda and I both tested negative.
Yeah, there. Okay.
Darn it.
I'm going to have to sign if I have another meeting.
Okay,
Have a great day,
thank you.
everybody.
Bye. Thank you.
Thank you.
Okay. Mike, you have another question?
I was
Anybody
going to
else?
ask Steve, but he had to leave.
You are. Oh. So
I was going to ask Steve, and maybe this is something we can figure out and talk about at a future meeting, but I was on a press call with Coos Health and Wellness yesterday, and it was with regards to the employees at Shutters Creek who had very different symptoms. One was the traditional, and the second employee really had limited symptoms. But because of that, they have kind of increased the number of symptoms to look for in testing patients, which I think is a good thing.
is.
They added things like congestion, loss of taste, smell, and some of those things. And some others, I didn't get them all. And that's what I was going to ask Stephen, but it's an interesting thing to follow.
Yes, definitely. Ashley, hold on, unmute. Wait, there. Okay, Ashley.
This probably is for Steve too, but one thing that I had that I was a little concerning to me is that one of our workers, her husband works at the prison. She's not coming to our office right now, but he was directly exposed to someone who was positive for coronavirus at the prison. And he was told to go about life as normal unless he shows symptoms. That's concerning to me because from what I understand, he should be quarantining at this time. I mean, because it's possible that he could have it and be spreading it. So that, I don't know, I felt like that was kind of concerning that was what he was told.
Just curious, Ashley, how long ago was that? This is Stephanie.
We were informed of this yesterday.
Huh.
But we don't know how long. I mean, he's been working out there. So, you know, we're just not sure how long he, you know, how many times he was exposed or whatnot. So I don't know. I just felt like that was kind of interesting, that he was told to just go about as normal unless he shows symptoms, which he could be asymptomatic and be a carrier, you know.
He should have been quarantined.
It's good. It's true. You know, all these questions, if you want to put them together, I can get Stephen to maybe even next week I'll put him on, maybe he can be our speaker and talk about it, because he's an ear, nose, and throat surgeon, and he does those swabs in the back of the throat and almost to your brain. So whatever. But it sounds like you all have many more questions, medical questions. So anything else? Anybody else? No?
I might just want to, Eva, I just might want to remind everybody, you've probably seen that Rotary International is going to have a gigantic program on Facebook Live around the world, a 1-hour program. Unfortunately, it's Saturday morning. Unfortunately, I think it's at 6 o'clock our time. But I think it'll be pretty interesting to see what clubs are doing on our globe to fight this virus. Additionally, our district is putting together a list of the various things that our clubs in District 5110 are doing to fight the virus. And you can see a lot of these things already on Facebook, but it's a great time to be a Rotarian. I'm really proud of our organization.
So with that, Carrie, you probably should talk about the hand sanitizer, or at least report on that. Oh, have you unmute it? No, you're unmuted. Okay, can you talk? I mean, yeah. So what Bill is talking about, if you could put some information together on that.
We will. In fact, Steve and I we've been working on a report to the district, to District 51.
Okay.
We'll do that.
Great. Anything else, anybody? Okay. Well, have a good day. Have a good week. Keep well. And thanks for all your input and your listening and all that. Okay.
Yeah.
Right.
And thank you very much, Ashley.
Yes, thanks, Ashley.
There she is. Yeah. Thanks again, Ashley.
Thank you for having me.
Thank you.
Okay. Thanks. Okay.
Thank you.
Bye.
Bye.
See you next week.